the impact to the baby when you have gestational diabetes during pregnancy could be a couple of things. And before getting to those things, I wanted to just explain again what gestational diabetes is. Gestational diabetes is a condition that diagnosed during your second and third trimester of pregnancy. So your basically your blood sugar levels are really high, and your body is not producing enough insulin, and so it affects a baby. So the baby's size can be affected. Your baby could be 9 pounds. If your baby is large, it's going to cause issues when you give birth and to your birth canal, and you're trying to deliver the baby. It can cause issues with the shoulder, not being able to come out, and which can lead to you having to proceed with a C-section instead of natural childbirth. So both trauma to you and to the baby. The other thing that it can affect is your baby can be born with low blood sugar, and the low blood sugar is treated by the medical personnel during the birth of the child. The other thing that it can cause is preterm, preemie baby. If you're not able to control that blood sugar during pregnancy as well, and it can affect their breathing, so it can cause respiratory distress, and so that they have to attend to that as well during when the baby's born. And the most horrible one is after birth. You could have a stillbirth. So again, these are not going to happen to you, but it can happen with this complication called gestational diabetes. So that's around the birth. But me as a mom, I didn't realize that my having gestational diabetes also affects my children. So basically, if my children didn't watch what they eat and they're not managing their lifestyle, that also predisposes them to having type 2 diabetes later in life. And I was alarmed when I when I found this out, and therefore I'm making sure I'm equipping them with all they need to be successful, to try to prevent that from happening to them. And that means making sure they learn how to eat well, teaching them how to eat well, what they should eat, and also not only that, making sure that they're physically active, make sure they're into sports. If they're not into sports, make sure that they are doing something daily, whether it's playing or walking. It's very important. Kids should be out there playing, not on their devices, out there playing and moving around, so that these issues can be avoided.